Hello, hello, hello. Welcome to another episode of Mind Your Body with Dr. Audra and this special series, AAA, Ask Audra Anything. It's me, Dr. Audra. Good morning, players. What's up, team? I'm so happy to be back in the States. I was just away my husband and I went to Ireland for a little bit because I was headed over to Prague to study at the DNS School of Rehabilitation, something I have been primed and was supposed to do in 2020. And then we all know what happened there. We'll move on. So this was the year that I was able to go back and study. Dr. Pavel Colar is a neurologist who has come up with some of the most cutting edge rehab techniques there is out there. It is absolutely mind-blowing. It has totally changed my practice. I started studying under him and his doctors while I was still in school. So that was around 2011, and just researching constantly changing as medicine does. And it's just come so far that it is one of the difference makers in my practice that makes us get such incredible results. So I'm so excited to be back. But while I was gone, people had messaged me some questions, and it had been a while since we had done one of these AAA, Ask Audra Anything. I just love them. So let's do this. All right. So one of the first questions I've gotten twice is if I read off something, they're like, it's so good. Like, how do you have time to do all this and write it out and then record it? And I just feel like that's such a compliment because English is my worst subject. Like, I'm terrible at it. Half the time, I don't even know what words I'm saying. I'm making up words. I'm making up sayings. So no, this is not written out. This is not scripted. It is totally me. Every once in a while, maybe I'll write on a Post-it note, but you'd be able to see it of like a statistic or a question or a point I want to come across, like a keyword. But no, I don't have time for scripting or reading or any of that. Like, reading would be hard. That would be so awkward. I wouldn't be able to have fun. And I don't care what you're doing. If you're not having fun, it's not going to be good. And that includes healing. That includes me treating. I don't care what your job is. Having fun is a key component. And you'll hear me say it over and over and over again. So let's get down to it. Once again, these segments, I love them. I actually just love this whole podcast. But you can DM me on Instagram at Dr. Audra Land, and I will put your questions in my folder so then I can come back to them when I do these segments. It's so fun for me. Come say hi, and we will go from there. So one of the first questions actually comes from one of my virtual clients. I randomly will take on one or two virtual clients at a time because my schedule is just so booked and I have a crazy wait list. But I will randomly open it up. That's another reason to follow me at Dr. Audra Lance on Instagram, is you'll be the first to know, or on this podcast. So keep listening. When I'm able to create that space in my schedule to work with you virtually, you get my phone number, you have constant access to me. It's called the edge because we're going to give you the edge. But stay tuned. Not sure when that's going to happen. I don't have time for it right now, but I'll try to open that up one day here. So one of those clients messaged me with an incredible question, and I love that they were able to feel their body and put this together. She has pelvic floor dysfunction, but had a knee problem going on along with a low back problem, and just was all over the place getting all these opinions from orthos, other doctors, and she couldn't get any answers. It was just really frustrated by the medical system. People wanted to do surgery, people wanted to do injections, and nothing seemed to be working. This is someone who wants to be active, loves to work out. I mean, mentally, emotionally, physically, moving helps us all. So she came to me wanting to get back her life back, essentially. And we did an evaluation, everything else, and came back, and we gave her a game plan of 2 exercises. I'm not going to overload you. I'm only going to do what I would actually do, which is not much, because we got to live our lives. We can't just spend 3 hours a day doing some exercises. Like, we're going to figure out what you need and let you do that. I mean, come on. So we were going after her low back because the knee problem was coming from her low back. So part one of the game plan, the first quarter, whatever sport you want to say, first quarter, we're in about football season. So first quarter, this is what we're going to do. Plan one. So you actually got to freaking do it if I'm only giving you one or two things. And she was phenomenal, compliant. I got a message from her 8 days after the initial. And she's, Audra, like, I'm centralizing, like you said, like in my low back and my knee feel great. But she's like, I haven't peed myself. And she was like, I didn't know we were also working on the pelvic floor. Like, what is going on? Why is this thing I'm doing for my back helping my pelvic floor? And that's part of the thing of how freaking cool the body is. It is all so connected. So here's a simple answer is your nerves in your low back that come from your spine go to all the different muscles in your body and innervate them in order to get the messages from your brain to them to connect, to activate, to work correctly. So the levels and the nerves we were working on in the low back also connected to the muscles of her pelvic floor. And with us trying to heal some of that inflammation and irritation in her low back, it was also in turn helping her pelvic floor. So that's like a neuromuscular component, neurology of the nerves in the brain, and then muscular, your muscles. So we need to always address the whole system. Just working on one muscle, you're probably not going to get anywhere. It might feel good. You might get some relief, but you need to always integrate the whole global pattern. And it was just a secondhand bonus to what our priority was with centralizing the low back. So that was pretty cool. And this is why this happens all the time in the clinic and practice with me, with my athletes, my celebrities of, hey, we're going to just go after this one thing first, focus on this, and other things automatically get better. Because once again, everything's connected in these systems and these pathways. It is pretty freaking cool. So this is why it's important for a full, good evaluation. It's important for you to do your homework because that's letting the doctor know, hey, are we on the right path? This is what we need to do. So that was kind of like a success win and just explaining, hey, how one thing can help the other with a little bit of science for you today. Hope you're awake. So from there, you might be like, okay, well, she's done. No, we're not done. No, we're not done. We have to heal, and then we have to go back and fix the compensation patterns and integrate them to the whole body globally in order for the brain to recognize this stuff to actually work. And then using my RM techniques, restorative movement techniques, which combines this amazing treatment from all over the world of these amazing people who have come up with it and I've studied around the world. But with RM techniques, we're addressing stress and mindset. Because over the years of me treating thousands of patients, if those two things aren't addressed, we don't get the trophies, we don't get the accolades, we don't win the things in our careers, we don't win in life. So we need to address it all. And that's why I created RM techniques. So there was a second question. What is that? What is RM techniques? I've gotten it a couple times here in the past month of wanting me to explain it on the podcast. So there you go. Huge of addressing the whole body and looking at it as a whole system. So pretty fun. Well, talking can be exhausting. And if you're watching on YouTube, you can see my nose is just running. When we were in Ireland, everything was blooming, like grass, everything. And I was just like, oh no. And of course, I didn't bring anything because I'm like, oh, I'm healthy. I have my vitamins. And it hit me hard. So traveling, time change, all that. And of course, Nashville has some things blooming right now. So just little fall allergies for you. Okay. On to the next question. Oh, shout out. You can see sometimes players design their own gear. This is one of my players' dogs. And they are kind enough to give it to me. So It's really cool. If you haven't seen it, shout out. That's the hat I'm wearing. I love hats. I could wear a hat every day because who really wants to wash their hair? I mean, come on. If you wash your hair, you kind of feel, girls, am I right? Like, okay, life is good. Like you completed a huge task for the day and you feel really good. It also takes up so much time that I feel like I don't have. And so, yeah, so throw on a hat, put up your hair. It's not good to wash your hair every day, they say. All right. The other question I had was someone messaged me wanting me to just touch on Morton's neuroma. So, Morton's neuroma is in the foot where the nerve sac gets inflamed. And this can cause pain in between your toes, numbness, tingling. It is really aggravating and really hurts. And a lot of times, doctors will say you need to inject it. And I've seen patients where that's worked, where that hasn't worked. And it's just a little bit of a mystery. So, of what to do. But what we need to do is we need to look at your foot as a whole, not just where that Morton's neuroma is. So, are you gripping your toes? Are you excessively using those flexors or extensors? Are you pronating? Are you supinating? What is your dorsiflexion like? What is your big toe extension like? Watch you walk. How are you using your foot in a global pattern? How are you using your foot when you move into a lunge, into a one leg stance, into a squat? What's your knee doing? What's your hip doing? What's your back doing? What's your core doing? What can you breathe correctly? I mean, hello. If you follow me on TikTok, Instagram, any of it, like I'm a big component, of breathing in your butthole. We need to use your trunk and core correctly. And most of us aren't. And you yourself are costing yourself stability and strength and causing your own injuries. Sorry, but I tell it to you straight. That's what I'm here for. And I'm happy to do it. Every person's different. I can't tell you there's a cookie cutter thing. And that's why I created these game plans so that you can figure out what exercise is causing your pain. So I have a plantar fasciitis one, but that's just a general for the foot. So that would be a great game plan to check out and see if you can relieve this pain yourself. And you get to hang out with me. We have fun. You get a whole sheet where you can keep track of everything and make notes for yourself and, of what I say. And they're short little videos. It's really fun. It's really easy. It's meant to do anywhere. My husband just did because of course I don't treat him. It's kind of like the Seinfeld episode. I'm burnt. I'm burnt. At the end of the day, the last thing I want to do is touch anyone. So we were on vacation and he pulled up the sciatica one and because he was just having a little low back discomfort and he was doing it and he healed himself. And I was like, all right, this is good tester just to make sure all this works, which I know it does. But so grab that. So we need to look at, okay, how is your foot activating? And figure out the points of where we need to go. Do you have a crazy trigger point that we need to eccentrically load in your hamstring to release your foot? I don't know. That's happened. That happened with me, actually. Can you even correctly activate your toes? Can you lift your big toe? And then can you lift your little toes? I made a video on TikTok about that. So it's a nice little challenge for you to try. And then go attack that foot. So the range of motion, the centration, the activation, and even look up the chain, and go from there. So, of course, this is something, even if you get the injection, I'm going to get on my soapbox here. Let me jump on. Here we go, sliding. If you're going to get injection, which sometimes I refer to the doctors to do, we might need that little injection or that steroid to calm everything down because there's a chemical change and inflammation is so great that you need to have that in order for our treatment to have an effect. So I'm not against all that. It is necessary at times. But, if you are going to have an injection, epidural, whatever, and you think that's the only thing you need to change your pain or help fix your injury, you are wrong. You can get the injection, that's fine. But then after that, we need to get to work. That is our window of time that we can change your compensation mechanisms and patterns and change the global pattern. We integrate everything what we're doing into your brain, like resetting your brain, like restarting your phone of, hey, this is how we correctly do it. And this is the best time for rehab if you're that far off and that's something you need. So don't sleep on that one. Please, 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 if you don't take anything else from this episode, If you or someone you know has to get an injection, which I'm not saying those are bad, they are needed in a lot of instances, or an epidural, if it's come to that point, if you're using your team of doctors and they all agree on that, that's great. But please don't forget to do the rehab work and putting in the effort to change how your brain uses your foot, or it's going to come back, or you're going to injure something else up the chain. Whew. How'd you like that one? I was pretty good surfing on that soapbox, huh? I love these. This is so fun. But I'm so happy to answer some of your questions. Please message me at Dr. Audra Lance. It was fun hanging out with you today. You're going to have the best day. Toodaloo.